Welcome to the Rummage Report for April 7th, 2026. Today's topic is World Health Day launches science campaign. Casey Liberty kicks us off today.
Hey guys, I just read about the World Health Day campaign launched by the WHO called Together for Health, Stand with Science. It's all about promoting scientific collaboration and a concept called One Health, which ties together human, animal, and environmental health. But here's the thing. This initiative raises some serious flags under the Trump administration. For everyday Americans, this could mean more taxes or inflation if the US starts pouring money back into WHO, which we withdrew from. That's about $700 million a year that could be redirected to help families struggling with rising grocery prices or healthcare costs. Plus, California is now joining WHO's Global Outbreak Alert Network, which feels like states are making their own rules that could contradict federal priorities. That's just reckless. We're also talking about potential job losses in biotech if we start prioritizing global collaboration over local manufacturing. I mean, we should be focusing on American jobs and keeping costs down for families, not following some international agenda. What do you guys think? Am I off base here?
Casey, I get your concerns about the financial implications of re-engaging with the WHO, especially with the Trump administration's focus on prioritizing American jobs and local manufacturing. But consider this: the One Health approach could actually save money in the long run by preventing disease outbreaks that cost billions in healthcare and lost productivity. For instance, the 2014 Ebola outbreak cost the U.S. economy an estimated $2.2 billion in direct and indirect costs. Investing in global health collaboration can help avoid these expensive crises, ultimately benefiting families in Ohio and elsewhere. Plus, California's move into the WHO framework doesn't necessarily mean a federal shift. States can innovate within their own healthcare systems without undermining national priorities.
Casey, you're right to be concerned about how funding WHO could affect local budgets, but let's not forget the bigger picture. Investing in global health collaboration isn't just about spending, it's about prevention. For example, the CDC estimates that every dollar spent on vaccination can save $3 in healthcare costs and $10 in additional societal costs. If we ignore global health, we risk facing pandemics that could cost us billions, like Ebola did in 2014. Plus, states like California stepping up to join WHO can actually lead to innovative solutions that benefit everyone, not just a few. It's about balancing local needs with global realities.
Sam, you're right that preventing disease outbreaks can save money in the long run, but we have to consider the immediate burden on taxpayers. Pouring funds back into the WHO could drain resources from local programs that are struggling right now. The $700 million annually we used to give to WHO could be better spent addressing rising healthcare costs and supporting small businesses in Ohio. Jordan, I agree that investing in health is crucial, but when we look at the numbers, we see that every dollar spent on global initiatives often translates to less funding for local needs. We need to prioritize American families first, not international agendas.
Casey, you raise a valid point about the immediate burden on taxpayers, but let's not overlook the potential long-term savings from investing in global health initiatives. The CDC's estimate that every dollar spent on vaccination saves $3 in healthcare costs shows that upfront spending can actually alleviate financial strain later on. Plus, the One Health approach isn't just an international agenda. It directly ties to local health outcomes. If we can prevent outbreaks that disrupt local economies and healthcare systems, families in Ohio could ultimately save on medical bills and lost wages. It's about finding a balance between immediate needs and long-term benefits.
Casey, you're right to highlight the immediate financial concerns of re-engaging with the WHO, but let's look at the bigger picture. The $700 million we use to contribute could be viewed as an investment in preventing costly outbreaks that burden our healthcare system. For instance, the CDC estimates that the 2014 Ebola outbreak cost the US economy $2.2 billion. If we neglect global health, we risk facing similar crises that could hit families in Ohio hard. Plus, California's involvement with WHO could lead to innovations that ultimately improve local health outcomes, which is a win for everyone, not just a few.
The conversation. Casey Liberty raised concerns about the World Health Organization's WHO new campaign, Together for Health, Stand with Science, arguing that re-engaging with the WHO could lead to higher taxes and job losses in biotech. He emphasized the need to prioritize American jobs and local budgets over international commitments. Sam Balance acknowledged the immediate financial concerns but argued that investing in global health could save money in the long run by preventing costly outbreaks. Jordan Progress echoed this sentiment, stressing that global health collaboration is essential for preventing pandemics and benefiting local health outcomes. The disagreement primarily revolved around the balance between immediate financial burdens and long-term benefits of global health investment. Worth thinking about. 1. Given the potential for significant savings from preventing disease outbreaks, how do you weigh the immediate financial concerns of taxpayers against the long-term benefits of investing in global health initiatives? 2. Should states like California be allowed to make independent decisions regarding WHO involvement, even if it conflicts with federal priorities, or should there be a unified national approach to global health? 3. How can we ensure that funding for global health initiatives does not come at the expense of essential local health services that families rely on? If you asked me, and remember, I'm a raccoon, I'd say investing in health is like raiding a trash can. Sometimes you have to dig deep to find the good stuff.